At 79, I ignored a slight tremor in my hand, brushing it off as just another sign of getting older. My doctor did the same, telling me not to worry. 6 months later, I was in the emergency room with a life-threatening condition that could have been prevented with one simple blood test. What seemed like a harmless shakiness was actually my body's desperate attempt to warn me. This happens every day to thousands of seniors across the country. Small, seemingly innocent symptoms that most doctors dismiss as normal aging are actually early warning signs of serious, sometimes fatal conditions. The tragedy is that when caught early, many of these diseases are treatable, even reversible. But by the time the obvious symptoms appear, it's often too late for the most effective treatments. In this video, I'm going to reveal 7 seemingly harmless symptoms that people over 75 often ignore, but which could be signaling a serious underlying disease. These aren't rare conditions, they're common health problems that affect millions of seniors, yet most healthcare providers miss the early signs until the disease has progressed significantly. From subtle changes in your breathing patterns to strange sensations in your feet, each of these symptoms provides a critical early warning that something might be seriously wrong. I'll explain what these symptoms really mean, why doctors often miss them, and exactly what tests you should ask for to get properly diagnosed before it's too late. Stay with me until the end, because the final symptom I'll discuss is one that nearly 65% of seniors experience regularly, but almost never report to their doctors. It's dismissed as an inevitable part of aging, yet it can indicate 5 different life-threatening conditions, all of which are treatable if caught early enough. Many people watching right now might be experiencing this very symptom and have no idea of the danger it could represent. Now, let's get started with 7 harmless-seeming symptoms that could actually be warning you of something much more serious. The first warning sign that's often mistaken for normal aging is a change in your handwriting. Many of us notice our handwriting becoming shakier or smaller as we get older, and we simply accept it as part of growing older. But these changes, particularly when they happen over months rather than years, could be signaling something much more serious. Take Margaret, a 78-year-old retired English teacher who had always taken pride in her elegant handwriting. Over a period of about 6 months, her children noticed that her birthday card signatures were becoming increasingly cramped and difficult to read. When they mentioned it, Margaret just laughed it off. "My hands aren't what they used to be," she said. What Margaret and her family didn't realize was that this shrinking handwriting, what doctors call micrographia, is one of the earliest signs of Parkinson's disease, often appearing years before the more recognized symptoms like tremors or stiffness. In fact, neurologists have found that these handwriting changes can appear up to 7 years before a formal diagnosis. For Thomas, an 82-year-old former accountant, the story was different. His handwriting became progressively more erratic, with letters floating above and below the line. Unlike Margaret, Thomas mentioned this to his doctor, who ordered a series of tests that revealed early signs of normal pressure hydrocephalus, excess fluid in the brain that was putting pressure on important neural pathways. After a simple procedure to drain the fluid, Thomas's handwriting returned to normal, and he avoided the cognitive decline and mobility issues that would have inevitably followed. The difference between these two stories? Awareness and action. Changes in handwriting after 75 are not just cosmetic issues, they can be your nervous system sending you urgent messages about what's happening in your brain. If you've noticed your handwriting changing, becoming smaller, more crowded, or unusually shaky, don't dismiss it. Ask your doctor specifically for a neurological assessment and, if necessary, request a referral to a movement disorder specialist who can perform more sensitive tests than your regular physician might be familiar with. The second seemingly harmless symptom that could be warning you of something serious is unexplained weight loss. Many people over 75 find themselves losing weight without trying, and both they and their doctors often view this as a positive development. After all, most healthcare providers spend years telling us to lose weight, so when it finally happens effortlessly, why question it? I want to tell you about Eleanor, a 76-year-old woman who had struggled with her weight most of her life. When she began losing 1 to 2 pounds a week without changing her diet or activity level, she was thrilled. Her primary care doctor congratulated her at her annual checkup, noting that her weight was now healthier than it had been in years. 6 months and 28 pounds later, Eleanor was diagnosed with advanced pancreatic cancer. The weight loss, which had seemed like such a blessing, had actually been the only early warning sign of a disease that's often fatal by the time symptoms like pain or jaundice appear. Had her doctor investigated the cause of her weight loss at that first appointment, the cancer might have been caught at a much more treatable stage. Compare that to Richard, 83, who noticed he'd lost about 10 pounds over 2 months. Rather than celebrating, he specifically asked his doctor to investigate why this was happening. His doctor ordered comprehensive testing, discovering early-stage colorectal cancer that was successfully treated with surgery alone, no chemotherapy needed. Today, Richard is healthy and active, all because he recognized that weight loss without effort isn't a gift, it's a warning. Once you pass 75, unexplained weight loss should always be considered a potential red flag. It could indicate cancer, gastrointestinal disorders, thyroid problems, or even early-stage heart failure, all conditions where early intervention can dramatically improve outcomes. If you've lost more than 5% of your body weight over 6 to 12 months without trying, don't assume it's a normal part of aging. Request comprehensive testing, including a complete blood count, thyroid function tests, screening for diabetes, and age-appropriate cancer screenings. Don't let your doctor dismiss it as finally getting to a healthy weight without investigating the cause. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. The third harmless-seeming symptom that could be signaling something serious is occasional breathlessness with everyday activities. After 75, many of us find ourselves a bit more winded when climbing stairs or walking uphill. It's easy to think, well, I'm just getting older, but this gradually increasing shortness of breath could be your body's way of telling you something is wrong with your heart or lungs. Consider the cases of 2 friends, both 77 years old, Harold and Walter. Both noticed they were becoming increasingly short of breath when walking up the slight incline to their community center. Harold assumed it was just age and began avoiding the hill, taking the longer, flatter route instead. Walter, however, mentioned it to his doctor. A simple echocardiogram revealed that Walter had aortic stenosis, a narrowing of the heart valve that pumps blood to the rest of the body. This condition, which affects about 12% of people over 75, progresses slowly but can lead to sudden cardiac death if left untreated. Walter received a valve replacement through a minimally invasive procedure and was back to his normal activities within weeks. Harold, meanwhile, continued to adapt his life around his increasing breathlessness. 2 years later, he collapsed while gardening and was rushed to the hospital, where doctors discovered his aortic valve was now severely narrowed, causing damage to his heart muscle. While he eventually received the same procedure as Walter, his recovery was much longer and less complete because of the damage that had already occurred. What many seniors don't realize is that our bodies are remarkably adaptable. We naturally begin doing less when activities make us short of breath. This means we might not notice the gradual progression of a serious condition until it's advanced. Breathlessness with activity isn't just an inevitable part of aging. It's often a sign that your heart or lungs are struggling. If you find yourself more short of breath than you were a year ago when doing the same activities, ask your doctor for specific cardiac and pulmonary testing. This might include an echocardiogram, stress test, or pulmonary function testing. These simple, non-invasive tests can catch conditions like heart valve disease, heart failure, coronary artery disease, and COPD at stages when treatment can still significantly improve both your quality of life and your longevity. The fourth symptom that's often brushed off as just part of growing older is increased urinary frequency, especially at night. How many of us over 75 have simply accepted that getting up multiple times during the night to use the bathroom is just what happens when you age? We joke about it with friends, buy night lights for the hallway, and adapt our lives around this seemingly inevitable inconvenience. But this symptom, doctors call it nocturia when it happens at night, can actually be signaling serious health problems that go far beyond simple bladder issues. Take Joseph, an 81-year-old retired engineer who started getting up 3 to 4 times each night to urinate. His doctor told him this was normal for his age and prescribed medication to reduce his symptoms. For a while, Joseph was getting up only once a night, a big improvement. But 6 months later, he was rushed to the hospital with dangerously high blood sugar. It turned out Joseph had developed diabetes, and the frequent urination had been one of the earliest warning signs, a sign that was masked by the medication his doctor prescribed without investigating the cause. Contrast this with Elizabeth, 79, who also began experiencing increased nighttime urination. Instead of just accepting medication, she insisted her doctor look for underlying causes. Testing revealed early-stage heart failure. Her heart wasn't pumping efficiently during the day, causing fluid to build up in her legs. When she lay down at night, this fluid would be reabsorbed into her bloodstream, resulting in increased urine production. With proper heart failure treatment, her nighttime urination returned to normal, and she avoided what could have become a life-threatening cardiac event. What many healthcare providers don't emphasize is that new or worsening urinary frequency after 75 can be a symptom of undiagnosed diabetes, heart failure, sleep apnea, or even certain cancers. It's not just about an aging bladder or prostate, it can be about serious systemic issues that affect your entire body. If you've noticed an increase in how often you need to urinate, especially at night, don't just ask for medication to reduce the symptoms. Request screening for diabetes, kidney function tests, and a basic cardiac evaluation. For men, this should include not just a prostate exam, but also tests that look beyond the prostate for systemic causes. These simple tests could reveal life-threatening conditions while they're still in their most treatable stages. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. The 5th warning sign that's often dismissed as normal aging is a subtle change in your balance or an increase in what might be described as clumsiness. Perhaps you found yourself reaching for walls or furniture more often when walking, or maybe you've had a few minor stumbles that you've laughed off as just being careless. These small changes in coordination and balance are frequently attributed to getting older, but they can actually be early signals of several serious neurological or cardiovascular conditions. Consider Florence, 84, who noticed she was occasionally stumbling or bumping into door frames, something that had never happened before. Her family teased her about needing to be more careful, and Florence herself assumed she just needed to pay more attention. For months, she compensated by walking more slowly and holding on to furniture. When she finally mentioned these episodes to her doctor, almost as an afterthought during a regular checkup, he ordered an MRI that revealed she had been experiencing small strokes, what doctors call silent strokes because they often go unnoticed. Each one was causing minor but cumulative damage to her brain. Then there's James, 76, who noticed he was becoming increasingly unsteady when getting out of chairs or turning quickly. Unlike Florence, James immediately brought this to his doctor's attention. Testing revealed he had cervical spinal stenosis, a narrowing of the spinal canal in his neck that was putting pressure on his spinal cord. A relatively simple surgical procedure relieved this pressure, and James's balance issues resolved completely. The difference in these outcomes highlights why it's so dangerous to dismiss changes in balance or coordination as just getting older. These symptoms can indicate serious conditions like silent strokes, normal pressure hydrocephalus, Parkinson's disease, spinal cord compression, or even brain tumors. Many of these conditions are treatable or manageable when caught early, but can lead to disability or death if allowed to progress. What's particularly concerning is how easily we adapt to these changes without realizing it. Research shows that by the time most seniors seek help for balance issues, they've already been unconsciously compensating for months or even years, holding furniture, avoiding certain movements, or changing how they walk. If you've noticed any changes in your stability, coordination, or sense of balance, even subtle ones, don't wait to mention them to your doctor. Ask specifically for a neurological assessment, including tests of your gait and balance, and if necessary, appropriate imaging studies of your brain and spine. These evaluations can catch serious problems before they progress to falls, which remain one of the leading causes of disability and death in people over 75. The sixth seemingly innocent symptom that could be warning you of something serious is a change in your sleep patterns. Whether it's taking longer to fall asleep, waking up frequently throughout the night, or feeling excessively tired during the day despite sufficient sleep, these changes are all too often dismissed with the phrase, "Well, sleep gets worse as you age." But while some changes in sleep are indeed related to normal aging, significant disruptions in your sleep patterns after 75 can be early warning signs of conditions that go far beyond simple insomnia. Let me tell you about Robert, 79, who had always been a solid sleeper, but gradually began waking up multiple times each night, gasping for air. His wife noticed, but Robert downplayed it. "Everyone snores sometimes," he would say. Even when he began falling asleep during daytime activities, while reading, watching TV, or even during conversations, he attributed it to just getting older. It wasn't until Robert fell asleep at the wheel and had a minor car accident that he finally saw a sleep specialist who diagnosed him with severe sleep apnea. During sleep studies, they discovered that Robert was actually stopping breathing more than 40 times per hour, causing his oxygen levels to drop dangerously low. This wasn't just affecting his sleep, it was putting him at high risk for heart attack, stroke, and cognitive decline. With proper treatment, Robert's energy returned, his thinking cleared, and his doctor told him he had likely added years to his life. Compare this to Catherine, 77, who noticed she was having trouble staying asleep and feeling increasingly anxious at night. Rather than assuming this was just part of aging, she mentioned it during her next checkup. Her doctor recognized these as potential symptoms of depression, which affects nearly 15% of adults over 75, but is frequently missed because the symptoms often differ from those in younger adults. With appropriate treatment, Catherine's sleep improved, as did her overall quality of life. What's important to understand is that sleep disturbances in seniors are associated with serious health risks. Poor sleep quality has been linked to increased rates of dementia, heart disease, diabetes, and even certain cancers. When these sleep changes are caused by undiagnosed conditions like sleep apnea, restless leg syndrome, heart failure, or depression, treating the underlying cause can not only improve sleep, but potentially extend life. If your sleep patterns have changed, whether you're sleeping more, sleeping less, or just sleeping differently, don't simply chalk up to aging. Ask your doctor about a referral to a sleep specialist who can conduct appropriate testing to identify any underlying causes. For many seniors, addressing these sleep issues doesn't just improve their nighttime rest, it fundamentally changes their health trajectory and adds healthy years to their life. The seventh and final symptom that may seem harmless but could be signaling something serious is persistent mild indigestion or heartburn. This is the symptom I mentioned earlier, the one that nearly 65% of seniors experience but rarely report to their doctors because it seems so trivial and easily managed with over-the-counter medications. After 75, many of us experience occasional digestive discomfort. We might take an antacid, avoid certain foods, or just wait for it to pass. But this seemingly minor nuisance could actually be your body's way of alerting you to several potentially serious conditions that are often missed until they've progressed to dangerous stages. Consider Henry, 83, who began experiencing what he described as just a bit of heartburn after meals. As a practical man who didn't like to make a fuss, Henry simply began taking over-the-counter antacids and avoided spicy foods. These measures helped control his symptoms, so he never mentioned them to his doctor. 18 months later, Henry was diagnosed with advanced esophageal cancer. What he had dismissed as simple heartburn had actually been an early warning sign of Barrett's esophagus, a precancerous condition that can be successfully treated when caught early. Now contrast this with Gloria, 76, who also experienced mild but persistent indigestion. Unlike Henry, Gloria reported these symptoms to her doctor, even though they weren't particularly severe. Her doctor ordered an upper endoscopy which revealed she had H. pylori infection, a common bacterial infection that increases the risk of stomach cancer. After a simple course of antibiotics, Gloria's indigestion resolved completely, and her risk of developing stomach cancer was significantly reduced. What many people don't realize is that digestive symptoms that are new or different after 75 should never be ignored, even if they're mild or easily controlled with medication. These symptoms can be early signs of conditions like esophageal or stomach cancer, pancreatic cancer, gallbladder disease, or even heart problems. Yes, heart disease can sometimes manifest as indigestion rather than chest pain, especially in women and older adults. The danger lies in how easy it is to mask these warning signs with over-the-counter medications. When we treat the symptom without investigating the cause, we might be silencing the only early warning our body can give us about a developing problem. If you've been experiencing new or different digestive symptoms, even mild ones that respond well to antacids or other over-the-counter remedies, make a point of discussing them with your doctor. Depending on your specific symptoms and risk factors, appropriate testing might include an upper endoscopy, abdominal ultrasound, or cardiac evaluation. These tests can catch serious conditions at their earliest and most treatable stages, potentially saving your life. We've just covered 7 seemingly harmless symptoms that could be signaling something much more serious after age 75. Changes in handwriting, unexplained weight loss, occasional breathlessness, increased urinary frequency, balance changes, sleep disturbances, and mild, persistent indigestion. The pattern is clear across all of these examples. The people who recognized these subtle changes as potential warning signs and sought appropriate testing had much better outcomes than those who simply attributed them to normal aging and adapted their lives around the symptoms. This isn't about becoming anxious about every minor change in your body. It's about understanding that after 75, our bodies communicate differently. The warning signs of serious disease are often quieter, more subtle, and easier to dismiss than they were when we were younger. What's particularly troubling is how our healthcare system often reinforces this problem. Many doctors are quick to attribute new symptoms in older adults to just aging without conducting the same thorough investigations they would perform for younger patients. This is why you must be your own advocate. Insistent, specific, and unwilling to accept it's just your age as a diagnosis. Remember, normal aging doesn't cause sudden or significant changes in function. It doesn't cause new symptoms that weren't present before. And most importantly, it doesn't cause symptoms that progressively worsen over weeks or months. Those patterns signal disease, not aging, and disease can often be treated effectively when caught early. The choices you make when you notice these subtle changes could literally be life or death decisions. Will you dismiss them as inevitable parts of growing older? Or will you recognize them as the valuable early warnings they might be? Thank you for joining me today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. In our next video, we'll be discussing the 5 medications commonly prescribed to seniors that might actually be doing more harm than good, and what alternatives you could discuss with your doctor. It's information that could change how you approach your healthcare, so you won't want to miss it. Thanks for watching, and we look forward to seeing you in the next video.